I've had many people forward me this post regarding Alphonso Davies' ACL reconstruction, asking for my opinion. I'm Kash Akhtar, I'm a knee surgeon. I specialise in ACL reconstruction, and firstly I just want to say that I've not been involved in this gentleman's care in any way, and I haven't spoken to anyone directly who has been treating him. We know that he tore his ACL playing for Canada against Argentina in the Copa America semi-final back in March of this year, and that he underwent ACL reconstruction with Christian Fink in Innsbruck, who has operated on Sadio Mane and quite a few other high-profile players for Bayern Munich. And this was pretty meta with the two of me here. I had the pleasure of chairing a session with Christian at the ISAKOS conference in Munich of this year. I have not discussed this case in any way with Christian, but he is known as one of the pioneers of quadriceps tendon ACL reconstruction, which is where you take an ACL graft from the tendon above the knee. You can do a small transverse incision or a longitudinal incision above the patella. You can see quite clearly on this photograph there is a short transverse incision above the patella, in keeping with the minimally invasive quadriceps tendon harvest, as opposed to the traditional longer incision below the kneecap for a patellar tendon harvest, which is the graft that's classically been used for professional footballers. Also, what you can't see is if there is a scar on the outer side of the knee, but I'll be pretty certain that he would have had a lateral extra-articular tenodesis or an anterolateral ligament reconstruction, which is a further reinforcement on the outside of the knee to protect the ACL against any further twisting injury in the future. And the thing that's clearly got everyone's attention is the degree of quadriceps muscle atrophy, which we've seen. And certainly, in my experience, it is more common with the quadriceps tendon graft than with patellar tendon graft. But at the same point, this is a supreme athlete who has the best possible rehabilitation facilities and no doubt is getting the best possible rehabilitation care. And if this can happen to a professional athlete, then of course it can happen to anyone. We can try and mitigate it. One of the key things we push is pre-rehabilitation ahead of surgery, and that is getting the muscles as strong and active as you possibly can prior to the operation, so that knowing that there will be a degree of wasting afterwards, you can mitigate that. And then post-operatively, we can try and help quadriceps recovery by icing the knee using an ice machine to try and reduce the inflammation in the knee and get quadriceps recovery, by getting the knee straight as soon as we possibly can so we can get the quadriceps activating. We can use an electrical muscle stimulator to try and encourage the quadriceps to grow and to fire and to activate. And also there are other new adjuncts such as blood flow restriction therapy, which can also allow the muscle to work harder and develop further at a lower load with lower intensity on it. And if you looked how jacked his arms are and compare it to his thigh, then this is a salient lesson for everyone. But Alphonso is an athlete and a wonderful footballer and seems like a really lovely guy when you see him on social media. And I have no doubt whatsoever that he is going to recover fully and come back bigger, better, faster, stronger than he ever was before. And I wish him all the best with his rehabilitation.